Good morning to my dear students. Students, today I am here to discuss a few important questions from the chapter Why Do We Fall Ill? So, students, this is actually a test paper of having 25 marks and you have to solve it within 1 hour. So, initially I am explaining all the answers and after that you can practice this question paper yourself. So, students, the first question, which is having the weightage of 1 mark, is name the causal organism of Kala Azar. So students, I want to tell you that the Kala Azar is caused by a protozoan and its name is Leishmania. We can write Leishmania as a causative agent. And question number 2, give one example of each disease caused by bacteria and viruses. So here we have to give examples, one of the viral disease and one of the bacterial disease. So students, AIDS is a viral disease and it is caused by HIV, human immunodeficiency virus, while typhoid is a bacterial disease and it is caused by a bacteria and the name of bacteria is Salmonella typhi. This is the causative agent. So HIV is the causative agent, a virus for AIDS, as well as Salmonella typhi, a causative agent for it's a bacteria and it causes typhoid. Now here in question number 3, it's of 2 marks. Which disease is more harmful, acute or chronic, and why? So here I want to answer that obviously the chronic disease is much more harmful because chronic disease is a kind of disease which lasts for a longer duration of time, as well as uh, uh, the patient who is suffering from a chronic disease does not recovers completely after the disease, as well as it was experienced that the oftenly weight loss is there, tiredness is there, and a patient is not is a patient is in a bedridden for a longer duration of time. So definitely he will have loss of work as well as the work efficiency too. So in this way I have to say that the chronic disease is most harmful comparatively to the acute disease. Now here the next question is question number 4 and it is also of having weightage of 2 marks, and the question is distinguish between career and vector. So students, you may be confused here कि what is the difference between career and vector. So I want to tell you that what are vectors and what are carriers. So actually a vector is an organism that passes a disease from one person to another person without getting infected. Means vector is never getting infected and it is just passing a disease from infected person to a healthy person, while a carrier is an organism that itself does not have any symptoms of the disease. Means carrier is also a kind of living organism which never have any kind of symptom. And I want to tell you that uh, this carrier can act as a intermediate host. Means a pathogen or a disease causing agent completes its life cycle either in the humans or the second host are these carriers. So vectors are just transmitting the pathogens while the carriers are required for the completion of their life cycle, and they are required as a host by pathogen for completion of their life cycle too, because it requires two hosts for completion of life cycle. So here the I have to say that here the main difference is vector is just a organism that passes a disease without getting infected, while the carrier is an organism in which the pathogen is completing its life cycle and it is also not getting infected, and it is also transmitting the disease causing pathogen from uh, infected person to a healthy person too. Okay, my next question, then I have to discuss next question. What may be the symptoms of a disease if liver is infected? So very simple. If liver is infected, so it will show various symptoms. I will discuss few of the symptoms. The first symptom is dark yellow urine and a light yellow stool. So due to the infection in the liver, the urine will become yellowish and the stool will become light yellowish, and the patient may have fever and it will and the patient will feel pain in the stomach region or the abdomen region. Now the next question is, explain the general ways of preventing infections. So basically, here I want to discuss few of the uh, general methods which we should have to use to prevent ourselves from the infections. So actually I want to tell you that there are the pathogens may spread through three different ways. Either the pathogens are airborne, or the pathogens are waterborne, or the pathogens are vector borne. So if we want to prevent ourselves, to prevention from the airborne diseases or airborne pathogens, we can prevent exposure of pathogens uh, by providing living conditions which are not overcrowded. Means if the more population will be there, the condition will be overcrowded, then what will happen, that there are greater chances of spreading of disease. So the society or the locality where we are living, it should not be overcrowded to, and by this way we can prevent ourselves from the airborne diseases. Now if we want to prevent ourselves from waterborne diseases, so we should have to drink a safe or clear or clean drinking water. If we want to prevent ourselves from the vector borne diseases, so we should have to keep our society clean, or we have to live in the clean environment. And in clean environment, the mosquito breeding as well as the, it will not allow the breeding ground for the mosquitoes as well as the house flies, so we can prevent ourselves. So these are the three different ways by which we can prevent ourselves. Now the next question, how does dehydration occur during diarrhea? So actually during the diarrhea, excessive fluid loss occurs either in the form of the loose motions or in the form of the vomiting. So while we are losing our fluid from the body, so we can have uh, dehydration. If we want ourselves from dehydration condition, so if we want to go for rehydration, then what can we do? We have to take complete bed rest, and along with it we have to take more fluid, okay, with electrolytes. And we can take ors means oral rehydration solutions, okay. So if you want to recover from dehydration, so we have to take ors, oral rehydration solutions, or we have to increase the fluid amount in our diet, okay. And what is the next question? Explain the methods of prevention of malaria. So students, as we know that malaria is caused by mosquito bite. If we want to prevent ourselves, so we have to prevent ourselves from the mosquito bite. We can use different kinds of mosquito nets while we are sleeping. We can use different kinds of mosquito repellent creams, okay. We can use different fumigants, which can through which we can keep mosquitoes away from us. As well as a patient who is suffering from malaria, a specific drug is there, name is quinine, and quinine is given to the patient to recover from the malaria, okay. And how does, last next question, how does food get contaminated and become toxic? So actually food gets contaminated by the action of the various bacteria as well as the viruses, okay. While the bacteria or viruses are mixing with the food particles, so they are producing certain chemicals, and these chemicals are making our food contaminated or toxic, okay. Now the second part of the question, name any one causative agent of food poisoning. So food poisoning can be take place by mainly bacteria, and there are various bacteria like Escherichia coli is one of the bacteria, Helicobacterium pylori is the another bacteria, Staphylococcus is the another bacteria, okay. Basically Staphylococcus is the major bacteria which is causing food poisoning. So the second answer is, out of these three you can write any one, Escherichia coli, Helicobacterium pylori, or Staphylococcus, okay. And the next part of the question is that mention any two symptoms that appear due to the consumption of such contaminated food. So definitely if we are consuming such contaminated food, so we will have food poisoning. And during the food poisoning we will feel pain in our abdomen region, we will feel dizziness, we will have indigestion, we will feel nausea or vomiting, okay, as well as stomach cramps. Now the last question, question number 10, it is of 5 marks. Write note on pulse polio program. And the second part of the question is write two symptoms of tuberculosis and polio. So students, I want to tell you that what is pulse polio program. Actually, pulse polio program is a single day public health project. Okay, and this project was initiated initially in the December 1995, ठीक है, in India, and this attempt was made to eradicate polio from India. And here pulse polio program, in this sentence, the pulse means a dose of polio vaccine, ठीक है, and it is applied for a short duration. So initially, according to the pulse polio program, a small dose of 3 drops was given to a newborn baby of age 1.5 month, then 2.5 month, and then 3.5 months. ठीक है, initially 3 drops are given at the age of the 1.5 month, then 3 drops are given at the age of 2.5 month, and finally 3 at the 3.5 month, and the final dose, which is called as booster dose, is given at the age of 1.5 years. And this vaccine consists milder forms of the polio viruses or viral particles, and our body is generating immunity against these polio viruses. Okay, so this was all about pulse polio program. And the second part of question is asking about tuberculosis, symptoms of tuberculosis and symptoms of polio. So initially I am talking about the symptoms of tuberculosis. A person who is having TB, so the TB can occur in basically in the lungs, okay, and it is called as pulmonary TB. And a person who is having pulmonary TB or TB into the lungs will have continuous fever, and he will have cough, and uh, while he will spit, so might be possible some clots of the blood can come along with the cough, and he will have chest pain, as well as he can feel breathlessness. Okay, while a person is suffering from polio, so the only symptom of polio is sore throat and headache. Okay, and then fever, vomiting, muscular pain, stiffness of the neck, tingling sensation of the limbs, and ultimately paralysis will result. Okay, so finally this is the initial symptom, sore throat and headache along with the fever, and then finally what will happen, the sufferer or the patient will have paralysis, ठीक है, resulting in the atrophy of the skeletal muscles, and finally deformity will affect on the limbs. So these are some common symptoms of the polio as well as tuberculosis. So I hope so you understood the answers of today's question paper. Now try to solve it yourself. Still, if you have any query, please ask. Thank you. Bye bye.